My audience members are Danny Maynard, Donnell Maynard, Jim Maynard, and Maddie Maynard. The purpose of my speech is to tell you about chronic kidney disease and what it is all about. The kidneys are an important part of your body functions and help you function in everyday life. 26 million Americans have chronic kidney disease and others are at risk. Everyone has kidney or kidneys and they help you function in everyday life. Most people tend to think that you need both kidneys to help you function. Well, I'm here today to tell you from personal experience and with one kidney that you do not need both kidneys to help you live. My goal for my speech is to help you understand what chronic kidney disease is. What is chronic kidney disease? How do people get chronic kidney disease? And the diagnosis of chronic kidney disease. Also, how lifelong treatment for chronic kidney disease is. I will start with telling you about what chronic kidney disease is and how it damages your kidneys. By definition, chronic kidney disease is also known as chronic renal disease. It is a progressive loss in renal function over a period of months or years. The symptoms of worsening kidney function are nonspecific and might include feeling generally unwell and experiencing a reduced appetite. In simple terms, it just means your kidneys are functioning less and less every day, and like the definition said, it can happen in months or years. This just makes their ability to do their work less likely to happen. If you detect the failure soon enough, you can get medicine prescribed to help you lessen how fast the progression of failure is going. The end result can lead to kidney failure, being put on dialysis, or lastly, a kidney transplant. I'm sure you're all curious as to how people even get chronic kidney disease and if it is common, but it is actually very rare in people my age. There are two main causes of chronic kidney disease. The two main causes are diabetes and high blood pressure. These are known for 2/3 of the cases in all Americans. High blood pressure can damage the blood vessels in the kidneys. When you damage the kidneys and the vessels, it makes them expand. High blood pressure puts a high blood flow on the kidneys vessels, and high blood flow expands and widens the vessels, which makes them weaker over time. Blood pressure puts more sugar into the vessels, and that stretches out the vessels. This stretches out the vessels and the filters, and it helps them leak useful protein into our urine. There are a few other causes to chronic kidney disease, and they are known as the other 1/3 cases. They are inflammation of the kidneys, inheritance, malformation during pregnancy, kidney stones, and repeated urinary tract infections. Who typically gets chronic kidney disease? Not everyone who has high blood pressure or diabetes gets chronic kidney disease. You actually don't have to have either. The disease is found typically in African Americans, Hispanics, and even seniors. And even in my children, it is found that the poor and ethnic groups are more commonly affected. I was diagnosed when I was 2. I was diagnosed with the lesser cases of urinary tract infections. My parents noticed that I was having urinary tract infections because whenever I urinated, it burned and it hurt my back. My parents then took me to the doctor after I complained after several times, and they ran a urine test and a blood test. The urine test was to see how much protein was in my urine, and the blood was to see how much blood was filtering through my kidneys per minute. Getting the diagnosis is done by running several different tests. The tests vary from urine tests, ultrasounds, and catheterizations. All tests are ran for the same thing, malformations in the kidney function. For example, if there's too much protein in the urine, they know that they have malformation in your kidneys. Blood tests are another way of testing for chronic kidney disease, and it is helpful to see how much blood filters through your urine and kidneys per minute. After the diagnosis, it doesn't stop there. Most patients result to treatment, and chronic kidney disease is lifelong, meaning that it does not stop and it goes through all your years of life. Since the disease has damaged your kidney, it cannot be fixed or taken back. What you can do is get medicine that can help it slow down the progress of kidney failure and at the rate at which it is harming you. Maintaining chronic kidney disease is easy for the most part. They just ask a few simple things for you. You just need to control any diabetes or high blood pressure if you have them. Maintain a low sodium and caffeine diet, which means you don't drink much pop or not put much salt on any of your meals. And they also ask that you stay away from alcohol and tobacco. It is recommended that you exercise most days of the week. ACE inhibitor and ARB medicines are medicines that are typically prescribed to most patients. Having chronic kidney disease doesn't make you unable or handicapped of doing anything. I play 2 sports and am very active outside of both of those sports. With the disease comes lower back pain, headaches, and I tend to be more tired than others. If each symptom gets worse, I then have to go to my kidney doctor. At my doctor, with those symptoms, I explain to him and he gives me a urine test and a blood test. With the urine test, like I said, he tests for how much blood passes through my kidney, and with the urine test, he tests the same thing. Every year after that, I have to go for a checkup. Then he takes a blood test and another urine test, and every other year he takes an ultrasound. With the ultrasound, the point of it is to test for kidney stones and to see any reflux in my kidney. By reflux, I mean the damage that the urinary tract infections have done. Reflux is also being put back into my kidney. It's like the urine that was supposed to go out whenever I urinate, but it refluxes back into my kidney. Now let's review what we have learned today. In this speech, I've talked about chronic kidney disease. I've explained to you what chronic kidney disease is, the causes, and the diagnosis. By listening to my speech, I hope I've taught you something new and interesting. Just know that if you're feeling any symptoms of pain in your back when you urinate, or if you're being less tired, or you're getting more headaches, that you might have a problem with your urinary tract infection. And by getting urinary tract infections, if they're repeating, you may have something malformation in your kidneys. So just know early detection of the disease can slow down the process of leading to kidney failure. My audience members were Danny Maynard, Donnell Maynard, Jim Maynard, and Maddie Maynard. Thank you all for listening to my speech, and I hope that you have enjoyed it and taken something out of it. Thank you.